Okay, we're here with one of Dr. Gallina's patients. And why don't you just basically tell everybody why you came to see Dr. Gallina?
Well, it happened about 3 years ago, really, and I was just sitting on my sofa, just really got out of showers, and I started cleaning my toenails, and all of a sudden the pain started coming, but actually it was sharp things were sticking in there. I've never heard nobody say this before. It just felt like things coming out of my feet, really. Haven't heard that from anybody, but, and then up underneath my feet, sharp objects were sticking in there. I even asked someone to come over and look at my foot.
Right.
It looked like something's coming out of it, and of course, they said, "Papa, nothing wrong." But the pain began to get worse and worse. The biggest thing is the sharpness of the sharp objects. Some people say needles. This was sharper than a needle to me. And yeah, the burning part of it is bad when you're walking. But the biggest thing, and the pain continually got worse and worse. So I really came to Dr. Dellon about, I read about the surgery. So I came to him and talked to him about it. And he's very honest. In fact, he said it's not really a guarantee. But, and he told me the things about it. So it wasn't quite as severe as it got to. And so I said, well, let me think about it. Since he wasn't really guaranteeing it. And it was kind of, I guess it was new here. It's not new, but so about, it must have been about 2 months ago. Well, the first time I went to the doctor with it, I didn't even know what it was. And I went to the doctor. Actually, I said, "Doc, I think I'm going crazy." And he says, "Why?" And then I told him what was happening. He laughed. And I said, "Maybe funny to you, but not me." He said, "Well, it sounds like you got neuropathy." So I went and had a nerve damage test, and they said I had a nerve damage. And I've been to 3 or 4 places. I've been to, neurologists, and gave me medicine. Medicine and said there was nothing you could do, and they checked my spine and everything, nothing wrong with that. And I've taken the highest dose that you can take on medicine. And so I just didn't take it anymore because it didn't do any good. Well, it got worse and worse, and I couldn't even work on it, and I had to, I even sat down and watched TV at night. It was an awful pain. And so finally I called the office here and for an appointment. And I said, I cannot bear this anymore. In fact, I told the doctor I was ready to go to the emergency room or something. It was in such a severe pain. And he went out of his way to do it because I had to get some tests done, and he went out of his way to do it the day after he normally does it because I didn't get all the tests in, and so he was going out of town. I really appreciate that of him because I was hurting bad, real bad. Got worse and worse, and I will say, like I said, he was honest then, and he's a very good doctor. I'm not just saying that. He's a good doctor. I tell anybody, I have told people that has this problem. He's kind. He's got some of the best bed manners of a doctor that I know of, and he seems like he has a heart, a compassion. And I like that. That's the reason why I came back. And when I talked to him the first time, that's the reason why I called back. And if it worked, great, I was happy. But if it only worked half, I'd been glad.
Right.
And but, I'm doing more now, and I'm working. He's done great, and I'm real happy with the surgery that he did. I'm happy with everything.
Great. And so you did the Dellon procedure.
Yes,
That's what he finally ended up doing. I'm sure you tried other things, but...
Yes, I tried I don't want to say anything against the laser. It tried to help some, but I didn't do. I did try the laser. I've tried Well, all the medicine, you know. And,
So the Dellon procedure was kind of like the last resort,
yes,
but
it was. Yes.
but of course you probably wish it was the first thing you did, right?
I did. I
yeah.
did.
So how much better are you now on a scale of 1 to?
I'm really actually I'm over what he said. He said he thought it would be about 83%. I think I'm about 90%, which is, for me, it don't bother me at all until at nighttime, and not when I'm sleeping. Only when I'm sitting down on my sofa and I'm watching the TV or something, but it's not like it was, and it doesn't bother me at all during the day. That's the truth. It doesn't bother me at all during the day, and I certainly wouldn't be saying this if it wasn't. And I would do it again. If my right one, it's not bad, it's just a little bit, but if it does get bad, I'll be having that done. And I'm just real pleased with it.
Well, good. Well, thank you very much for your testimony.